protecting yourself from COVID-19 while in the laboratory. The two main goals of this training are to increase health and safety awareness around potential exposure to COVID-19 and to understand how to minimize risk to COVID-19 in the laboratory setting. This training is adapted from NIH's training tools. Information on COVID-19 is rapidly changing, sometimes daily, referred to reliable sources such as the CDC, OSHA, NIOSH, state health departments, and peer-reviewed science publications, and not primarily on social media sites. What is SARS-CoV-2? The virus has been named SARS-CoV-2, and the disease it causes has been named Coronavirus Disease 2019, which is abbreviated COVID-19. SARS stands for Severe Acute Respiratory Distress Syndrome. Community spread means some people have been infected, and it's not known how or where they became exposed. There is little, if any, immunity in humans. How is COVID-19 transmitted? Spread of SARS-CoV-2, the virus that causes COVID-19, is thought to occur in the same way that seasonal flu spreads. Flu viruses are spread mainly from person to person through coughing or sneezing by people with influenza. We will not fully know how it is transmitted until later when scientists have time to evaluate it. There are several ways that it can be transmitted. One is the droplet, through respiratory secretions from coughing or sneezing, which is landing on mucosal surfaces including the nose, the mouth, and the eyes, through aerosols, where a solid particle or liquid droplet is suspended in the air, through physical contact, where you have touching something with SARS-2 virus on it and then touching your mouth, nose, or eyes, and there's other possible routes, including through fecal matter. Keep in mind that the virus particles are not visible to the naked eye. The most harmful particles are submicron, shorter than 1/1,000,000th of a meter. The incubation period means the time between exposure to the virus and beginning to have symptoms of the disease. Most estimates of the incubation period for COVID-19 range from 1 to 14 days, most commonly around 5 days. With COVID-19, symptoms may show 2 to 14 days after exposure. The CDC indicates that people are most contagious when they are the most symptomatic. Several studies show people may be most contagious before even developing symptoms. Some people may be asymptomatic carriers. COVID-19 can cause mild to severe symptoms. The symptoms may appear 2 to 14 days after exposure. Most common symptoms include the fever, cough, or shortness of breath. Other symptoms may include sore throat, runny or stuffy nose, body aches, headache, chills, fatigue, gastrointestinal symptoms like diarrhea or nausea, and/or a loss of smell and taste. Most people will have mild symptoms and should recover at home and not go to the hospital or emergency room. The reason to stay away from emergency rooms, hospitals, and family doctors is to avoid spreading SARS-CoV-2 to others. You should also separate yourself from other people at home and practice good personal and environmental hygiene. There are also severe symptoms or emergency warning signs for COVID-19. Do get medical attention immediately if you have difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. This list of severe symptoms is not all-inclusive. Please consult your medical provider for any other symptoms that are severe or concerning. How long does SARS-CoV-2 survive outside of the body? It is not yet clear how long the coronavirus can live on surfaces, but it seems to behave like other coronaviruses. The virus may persist on surfaces for a few hours or up to several days, depending on conditions and the type of surface. It is likely that it can be killed with a simple disinfectant on the EPA-registered list. Contact time is very important. There are ongoing investigations to learn more. As is the case with seasonal flu, certain conditions appear to put some individuals at increased risk of complications associated with COVID-19. These conditions include heart disease, lung disease such as asthma, diabetes, and suppressed immune systems. The elderly have higher rates of severe illness from COVID-19. Children and younger adults have less severe disease and death. Because COVID-19 is new, There are a lot of scientific unknowns, such as the impact on pregnant women and their fetuses. How can you minimize risk of exposure to hazards like COVID-19 in the lab? You should already be familiar with the hierarchy of controls, which can be used to help mitigate the risk of exposure. The following slides rank the effectiveness of the 5 areas of control we have. The most effective control we have is to eliminate the hazard. In this case, the hazard is COVID-19. If you are considered high risk, work remotely. Under no circumstances should you come to campus if you feel unwell. Help stop the spread by staying home. If you cannot eliminate the hazard of COVID-19, the next most effective control is to replace the hazard or substitute it for something less hazardous. Unfortunately, in this situation, it is not possible to replace COVID-19 with something else. The next most effective controls are engineering controls. When you cannot remove the hazard, you can mitigate the hazard by isolating people from the hazard. An example of this is installing or using a ventilation system like a fume hood, which is already in most labs. Engineering controls protect workers by removing hazardous conditions or by placing a barrier between the worker and the hazard. The easiest example of this is a fume hood, which locally removes airborne emissions in the laboratory. They do not interfere with productivity, personal comfort, and usually make it easier to do work. A fume hood is kind of like a closet that provides local ventilation engineered to limit exposure to hazardous or toxic dust, fumes, or vapors. Its purpose is to protect workers by removing air out, usually outside of the building. Do not add curtains or barriers inside the fume hood. It will disrupt airflow. Fume hoods are designed to change the air in the entire room a specified number of times per hour. So, it is helpful to keep the lab door closed at all times. Typically, they have face velocities of 80 to 120 feet per minute. Remember, biosafety cabinets are not fume hoods. There are some good practices on using a fume hood. Don't clutter the hood with storage. It introduces turbulence and reduces the protection to the user. Do store chemicals behind the 6-inch line if they need to be in there. Don't use if the fume hood does not work or fails inspection. Additional good practices include keeping the sash as low as possible when working. Maximum height should be at working height. Keep the lab door closed. Open lab doors introduce turbulence and makes it less safe for the user. If the fume hood is not in use, shut the sash to save energy. Remember to always work behind the glass. If the doors open horizontally, you should open the sash doors to the side and keep the glass in front of you. The glass is the barrier that protects you. Next after engineering controls is administrative controls. This type of control limits exposures by changing the way you work. Examples of administrative controls include limiting personnel exposure based on time, signage, training, work practices like no food or drink. This can be done by staggered work schedules, reduced lab occupancies, regular surface cleaning, and documentation of cleaning. If possible, move instrumentation to promote physical distancing, and use email, phone, and teleconferencing instead of meeting in person. What are some good work practices? Do wash your hands often for at least 20 seconds with soap and water. Do wear a mask properly and wash your hands each time you adjust your mask. Do minimize your exposure to others by staggering work schedules. Do maximize physical distancing by designating workspaces and moving instruments further apart. Do maintain routine cleaning and disinfection of surfaces and equipment. In the same vein, don't come in when you are not feeling well. Don't touch your nose, mouth, and eyes. Don't share phones, desks, workspaces, and equipment whenever possible. Not eating or drinking in the lab minimizes risk to exposure. Which is better, soap and water or hand sanitizer? Soap and water is most effective at removing the virus. In the absence of soap and water, use sanitizer that contains at least 60% alcohol. Proper hand washing is an important good work practice that is good for chemical and personal hygiene. First, wet your hands with clean running water. Then apply soap and lather the soap all over your hands, including the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands under running water, and then dry your hands using a clean towel. Be sure to dispose of the towel in a trash bin. Removing gloves properly is as important as wearing them when you need to. To keep whatever might be on the gloves from splashing onto you as you remove them, peel the glove away from your body, pulling it inside out. Hold the inverted glove you just removed in your gloved hand. Peel off the second glove by grasping the inside of the glove at the top of your wrist. Turn the second glove inside out while pulling it away from your body, leaving the first glove inside the second glove. Dispose of the gloves safely and appropriately. Do not reuse the gloves. Clean your hands immediately after removing gloves. Remember, wearing gloves is not a substitute for washing your hands. Assume they are contaminated and dispose of them properly. Your hands can still get contaminated while wearing or removing gloves. Always wash your hands after removing gloves. It is important to establish a cleaning procedure using disinfectants that deactivate the virus. You can refer to EPA's registered list. Remember to wear gloves when cleaning and make sure there is adequate ventilation. Document when cleaning is performed. And use alcohol-based sanitizer if hand washing is not readily available. Per CDC's cleaning guidelines, first, clean. Cleaning removes dirt, including germs from surfaces. Cleaning alone does not kill germs. Then, disinfect. Disinfection works by using chemicals, for example, EPA-registered disinfectants to kill germs on surfaces. Contact time for disinfection is important. Contact time is the time the product must remain wet to kill the virus and is sometimes referred to as kill time or dwell time. Observe that the area is visibly wet for the entire contact time. The EPA list and product labels include contact time. Follow manufacturer's instructions for dilution and use. Check expiration dates. Disinfectants break down, and expired disinfectants should not be used. Disinfectants do a good job to kill various pathogens and obviously also come with health effects. Health effects of disinfectants may include skin rashes or dermatitis, irritation of the nose, eyes, mouth, and occupational asthma is associated with sodium hypochlorite, which is the active ingredient in bleach, quaternary ammonium, and glutaraldehyde. Remember to not mix products. That can be deadly. Recall that safety data sheets, or SDSs, provide helpful information on health effects in addition to information on the chemicals themselves. It is highly recommended to check the SDS of a chemical before you start working. As previously mentioned, disinfectants can have many health effects, but there are safer chemicals available. You can search for these additional options by using the search function on the EPA site. If possible, choose products that have these ingredients, as they are not known to cause asthma. Hydrogen peroxide, but without peracetic acid. Products with alcohol, like ethanol or isopropanol. Lactic acid or citric acid. The final control, and the least effective, is PPE, or personal protective equipment. While PPE does not eliminate risk, there are situations where they must be used. Examples include safety glasses, face shields, gloves, hearing protection, and lab coats. Using PPE sometimes gives us the false sense of invincibility, which can be very dangerous. Remember that PPE is the least effective of all the controls, but must be worn if it provides the appropriate additional protection. If normally used in the lab, wear a lab coat, gloves, safety glasses, or goggles for more protection. As always, specific PPE should be selected based on hazard of work. Reduce contamination. Gloves should not touch your belongings or other objects like door handles or your face or face mask. To protect others that you work with, mask wearing is required in all Hofstra buildings, including in all of the laboratories. To be clear, a cloth mask is not considered PPE, as it is not meant to protect the wearer. It is intended to protect those around you. If you want to use a face shield, you still need to wear a mask. This is similar to if you're using a face shield in the lab. You still need to wear the appropriate safety glasses or goggles. Face shields do not provide adequate protection when worn alone. Under most situations, you do not need to wear a respirator in the lab, unless you are working with hazards that require the use of a respirator. Fit testing prior to use is required if you use a respirator or respirator mask, and a user seal check is required each time the respirator is donned. Remember that the hierarchy of controls can be used to mitigate the risk of exposure. It is our responsibility to wear a face covering in the form of a cloth mask or a surgical mask to protect others. Clean and document cleaning of workspaces and equipment. Wash your hands frequently and properly. And remember to stay safe.